Okay, we're going to ask a few questions that have been raised on this approach, and Mart's going to give some responses. The first is there not a risk in this approach that we are just implementing a government plan and that World Vision becomes part of the government in this?
Okay. For us in Senegal, it's not a risk to implement government plan. As I explained in the beginning, from the first step, we set up, or we are part in the consultation group or consultation frame. And this group or this frame are composed by all these people. Could be government, could be NGOs, could be faith-based organization, the regional development agency, and all the CBOs representative, and the local government, even the private sector. And all the key actors are working in the ADP area, are part of this group. So once this group is set up, we have the local planning committee who is responsible for all the local development planning processes. And once the document is produced, the local development plan is not a government plan. It's the development plan for all the villages within the ADP area. And all these activities will be funded by government, local government, central government, NGOs like World Vision, like UNICEF, like Catholic Relief Services, and also private sector like we have in Kenya. So this local development plan is not a government plan, but it's a rural community plan where all the villages has key activities planned for the 5 years. And World Vision also is part of the key funding partners.
Okay. And how long does this process take, the design of a local plan?
The design of a local plan, if we are in an area where the plan in terms of budgeting is funded 100% by the government, is a bit longer, because the plan, the processes, and the different steps are by a consultant, and the consultant signed a contract with the national local development plan program in the central at the central level. But in the areas where World Vision is contributing financially, partnering with others, we sign a MOU with the regional development agency, and in this case, we are more flexible to control the time. And generally, it can take 1 year. When I said 1 year, from the consultation frame to the last step of the approbation of the local development, of the document itself, depending on the context where we have contributing financially. But generally, with the preparation, it can take, let's say, 1 year, including all the preparation and editing the documents and so on, which is corresponding more or less to our design assessment and design phase in Senegal.
What are the challenges for World Vision in joining this process?
One of the key challenges for us is because we are part of a group and we accept to go partnering with other agencies or other NGOs or other groups. One of the challenges is the time frame. For example, when we say that in World Vision we want to submit the provisional design document in June or July, before October in general, the process, if we start later, it's a bit difficult for us to respect this commitment to submit the document to the support office in July or September. This is one issue. The other issue is because we are in a group and we are trying to advocate for children, the other partners don't have sometimes the same priorities as us. For example, for them, the priorities could be infrastructure, buildings, but as World Vision, one of the challenges is how to advocate more and to get more resources and more synergies around the well-being of the children. this is two big challenges we have in this process.
Okay. And what is the place of the most vulnerable within the communities in this PLD process? Do they have a voice? And if so, how?
Very good question. Very good question. As I explained, for example, from this step to this step, here you have the faith-based organization in the consultation group. And in our context, the faith-based organizations are also working with a lot of vulnerable groups. So we ensure that when we are in the beginning of the process, all these actors, when you do the partner analysis, are working with vulnerable groups. And here, in the data collection process, we ensure that children are targeted as key actors in the process. For example, here we have children focus group, women's interview, grandmother focus group, young minors focus group. So we ensure that during the data collection process, children or vulnerable groups, women or grandmothers, are targeted. Because if you don't collect data around these specific groups, you will not get enough information when you are doing the data analysis process. And also, the other level for us to involve them is here, during the implementation and management, joint implementation and joint management. I talk about the community, citizen voice and action, doing advocacy to ensure that commitments and to monitor that all the engagement for the local development plan are respected. So here, children, when they have capacities and when their capacity is built, or vulnerable group has a voice to talk about or to ensure or to monitor that all these activities in the local development plan, when they get information that this activity or this activity or this activity will be implemented in your village and this has to be done in this time frame, they have the opportunity to advocate for and to monitor to ensure that everything planned is implementing as planned.
Okay. And the last question, what support does World Vision need from the Global World Vision Partnership, from support offices, regional offices or the Global Centre in implementing this approach?
For us in Senegal, is one thing is flexibility, because World Vision, as you know, we have deadlines, we have systems, and we have many things that are really internal. For example, when we are in this kind of partnering, and you are not the only actor or the key actor in the process, it's very difficult to say, okay, I will submit this document before end of July or end of September, because this is a participative process and it's difficult to push everybody at the same time. So for us, we need more flexibility from the support offices, for example, in terms of deadlines, submitting the key documents, especially the provisional design documents. The other things we need as support from the Global Center is the approbation for World Vision Senegal to implement this process in terms of partnering around budget. We are reflecting and we really want to test it in the 5 first ADP, where we design through IPM and this process. Now we will start the implementation phase and we need the approbation for the Global Center to go through these processes, because they have a lot of implications in terms of budgeting and finance. And the other things is we have reporting, for example. It would be great for us in our financial reporting to show how the other partners can contribute, or how the other partners are contributing financially to the well-being of children. So how is it possible to adapt our some formats or some system in the partnership?
Okay, thank you.